When I came to America, I saw that the advancement of medicine is amazing, that technology is amazing, but the real basic care to people who are migrant, who are people who are minority, people who have no access to healthcare, is I'm at loss of word.
Dr. K, take one.
I moved to America on 4th of July in 1982. My heart was in the community, so decided to open up a practice on Devon Avenue, where there was not a single physician practicing there. Somehow I felt that these are people who are lost in the healthcare industry. What I learned, that the service has to go to a community. I have always gone out of my way to help people, but I feel that when I'm treating a patient, I feel them as my own family. I want my children to appreciate the value of community, the value of helping people in need.
In the earliest days of the pandemic, we found that the institutional support was limited to areas where socioeconomic status was the highest.
You really saw the disparities of healthcare come to light. You saw Black and brown communities demonstrating higher mortality rates, more hospitalizations, and lower access to healthcare.
And we thought, how are we going to fix this? How can communities that look like me also be served?
Both the sons, they came to me and said, Dad, you have to come back into the community and try and help them out.
It really started with just doing a couple testing sites. We started one right on Devon, right next to Devon where we started.
So we went, got a tent.
And we were in a parking lot, we built a tent.
So he hands me a hammer and the nail. He says, now start nailing this tent. In my 40 years, I've not done that. What are you talking about? He says, no, we have to create this tent. That's the only way we can do the testing out there.
And we started seeing patients. First day 7, second day 20, and third day we had a line of hundreds of people.
All the community started calling us, oh, we want to do this in our community. We want to do this in our community. This testing is amazing. So we designed the whole protocol with both my kids.
We trained testers, we trained vaccine providers, we deployed multiple cold storage technologies, a system of using mobile iPads to go out and deliver care to the communities that needed it the most.
How do we take what my dad's doing in one community and expand it to other communities who need help just like ours?
We're trying to solve the last mile problem in community health, which is how do you take services and deliver those to patients in the most hard to reach areas who need it the most, who otherwise don't have access to it.
The standard model of healthcare is based on a brick and mortar operation. People go to the clinic, they go to an emergency room. What we at Prism are doing, we're saying we're going to come out to you where you are in a space where you feel comfortable.
Prism is partnered with Chicago Public Schools, and what we do is we provide a mobile van packed with all of the necessary supplies for a student to get any service that they need to stay in school, whether that be a physical or a vaccination or a hearing test or a vision test.
Parents can work with Prism directly. They don't have to come in. They can stay at work. They can give us consent forms.
It's been a great opportunity for us to really hone the skills that we learned during the pandemic in finding creative solutions to deliver healthcare where it's most convenient for people.
Come back up.
Prism's entire mission is to make those barriers to access disappear. And we do that by bringing access directly to the doorstep of populations. Providing care directly in long-term care facilities, we're able to eliminate the barrier of access to healthcare for some of the most vulnerable people.
Residents love it when we come in. First thing about healthcare is it's an interaction. It's an interaction between a provider and a patient.
Can I
I go now?
Thank you so much.
Our family has been involved in community service and healthcare for decades, and I see a lot of the work that we're doing, my brother and I, as carrying on the mantle and continuing to serve communities.
It's a calling and it's a duty because we are from the communities that we are serving. We grew up in them. They enabled our success. They enabled who we are today.
The inner happiness which comes to you by serving these communities, especially one who are in need, is absolutely rewarding. No money, no fame, no name can give you that happiness.